Hi there, my name is Garet and I'm here to do my presentation on bad breath. So we've all had those situations where we've woken up in the morning and we've had a child, a brother, sister, a significant other um, turn and face us, and we're having a conversation and they casually just say, "Oh my God, your breath stinks." There are so many reasons for this to factor into the conversation as to why your breath actually stinks. The main thing is that you really want to make sure that you have the cleanest oral cavity that you can have. Our oral cavity is host to 700 different types of bacteria, and we all have 32 to 72 different varieties that live within our oral cavity. So make sure before you go to bed, at least twice a day, even, you want to make sure that you floss, that you brush your teeth thoroughly, that you use a good toothpaste, and that you use a mouthwash that will help you clean your oral cavity. Chances are that that might not be enough if you have really bad breath. Um, so, dentists and health practitioners will also tell you that you should be scraping your tongue with a tongue scraper. Always best to start scraping from the back of the tongue to the front. Chances are, if you are a smoker, you drink coffee, you have a diet that is high in sugar and starches, that you will most likely start to get some brown, not so nice saliva scrapings off of your tongue. And the more that you do this, you'll find out that your tongue becomes a little bit more pink, and the saliva that you start to scrape off will become definitely much more clear, which is a good sign because that will then start to show you that you're on the right track to getting a better breath and less bad bacteria that can colonize within your oral cavity. So basically, the bad breath is all contributed to different strains and varieties of bacteria within your mouth. The most common type is Streptococcus mutans that grow within your mouth. Again, they grow and they feed off of the sugars and starches within your diet. So, very important that you try as best as you can to limit your intake of sugar and starches, um, especially if you have dental disease, tooth decay. Those are all things that you really want to try to limit in your diet to help prevent yourself by having all these different types of bad bacteria working against you within your mouth. As humans, we can never get rid of bad bacteria in your mouth. We all have it. We all deal with it. It's how you look after your oral cavity that will really help show you how to prevent bad bacteria, bad breath, and everything bad within your oral cavity. There's always a part cure for everything. Um, Not necessarily going to stop it, but definitely help make that awkward morning when you wake up and your significant other, brother, sister, child turns around and says to you, "Oh my God, mom, dad, you need to brush your teeth. Your breath really stinks." It's an embarrassing moment that we all go through, and it's a moment that we all don't want to have to go through. So, having our bad bacteria in our mouth, basically, you know, your mouth is a jungle. It's a jungle full of different bacteria, different growths, bad, good, and everything in between. Um, Again, they're all considered harmless. Bacteria in the mouth increases when excess sugars are added to our diet. Um, there's no way of getting rid of the different types. You really do want to watch out for the Streptococcus, which is the most harmful bacteria within the oral cavity. Streptococcus mutans Um, live in the mouth. Streptococcus is by far the most harmful bacteria living within the oral cavity. It produces enamel eroding acid. Main cause of Streptococcus mutans is tooth decay, which is a horrible dental disease. Streptococcus mutans has been implicated of most of all the initiator of dental cavities. So Streptococcus mutans is basically the bacteria that attacks your oral cavity, and that's where you start to develop the cavities within your mouth. Streptococcus mutans is a bad bacteria that is the headline started of all the negative things that could go wrong within the confines of your oral cavity. Tooth decay and cavities, giving your teeth the proper everyday care they deserve and need to stay and maintain healthy. Within a healthy environment can be achieved by visiting your dentist on a regular basis, and all these steps will help keep bad bacteria such as Streptococcus mutans away and out of your oral cavity. Again, proper brushing twice a day, flossing, a good mouthwash. Bad breath is something that we all fear day to day. Bad breath is due to massive buildup of bacteria on the tongue. Poor and inadequate dental habits can cause halitosis, which is often what the odor is caused by. It's the bacteria that is present below the gum lines and on the back of the tongue. Brushing and flossing daily can help reduce bad breath. Bad breath can be caused by multiple factors, all of which can be created from bad dental health habits. We can never rid ourselves of bad breath, but we can limit the odor with the practice of good oral hygiene. So again, if you want to rid yourself of bad bacteria or have it not affect your daily life, it is always good to make sure again that you have good mouthwash. You brush twice a day. You use dental floss, and you try to limit the sugar and starches within your diet on a daily basis to try to maintain a better oral health, and also visiting your dentist on a regular basis. So that was my presentation on bad bacteria within the oral cavity. Hope you enjoyed. Now it's time for us all to go to bed, as it is late on Sunday night, of course, and hopefully I'll wake up with better breath because I have brushed, flossed, used mouthwash, and I am ready for bed. Have a good night. Bye.